Hi, this is Dr. J. Park with Cosmetic Microneedling Training.com. This is your comprehensive manual for medical professionals. All right, let's get right into it. Microneedling is one of the MVPs of skincare treatments. This treatment is also called collagen induction therapy because it stimulates your skin's natural ability to repair itself and maximize collagen and elastin production. It's a minimally invasive procedure that's now a mainstream in aesthetic medicine. Why? Because it's a powerhouse for skin rejuvenation, scar treatment, and a whole bunch of other skin conditions. This manual right here is your comprehensive playbook. It will take you step by step through the principles, practices, and patient care involved in microneedling, all backed by the latest research and clinical evidence. All right. So, what exactly is microneedling? Here's the breakdown. You're using fine, sterile needles to create micro injuries on the skin surface. Now, don't let the injury scare you. You're not going to hurt your patients. These micro injuries trigger a natural wound healing process that boosts collagen and elastin production, making the skin look smoother, firmer, and more hydrated. Over the last decade, microneedling has evolved into a versatile go-to treatment for a variety of skin concerns. Think about acne scars, wrinkles, fine lines, stretch marks, and even hair loss. You're not just treating the skin surface, you're transforming it from the inside out. Here's some quick history for context. The idea of using needles to rejuvenate the skin isn't new. It goes back before the 1990s. It wasn't until early 2000s that microneedling devices hit the market, and now they're a staple in aesthetic practices. This technique is backed by clinical research that shows it's safer, less invasive alternative to many other cosmetic procedures. It's proven, it works. The scope of this manual is to be your ultimate guide. You're not just learning the mechanics of microneedling. You're getting the scientific principles, foundations, practical applications, insights on how to manage patient care. We've packed in pivotal studies, expert recommendations, and best practices so you can deliver world-class results while keeping your patients safe and satisfied. Before we get into the how, we need to understand what we're working with, the skin. It's the largest organ in the human body and serves as a protective barrier. It shields us from the mechanical, thermal, and physical injury. It's also the gatekeeper for temperature regulation and plays a big role in sensory perception. Now, the skin is made up of three layers: epidermis, the most outer layer responsible for the barrier function and skin tone; dermis, the middle layer housing collagen and elastin fibers. This is where the magic happens when it comes to microneedling. Hypodermis, this deeper layer handles fat storage, insulation, and skin cushioning. These layers are the reason your skin looks great, heals itself, and stays healthy. And microneedling taps into this natural ability to repair and regenerate. Mechanism of microneedling. When we perform microneedling, we're creating controlled micro injuries with needles that range from 0.5 millimeters to 2.5 millimeters in depth. These micro injuries kickstart the body's natural wound healing response, leading to the release of growth factors that boost collagen and elastin production. The best part? We get all these benefits without causing significant damage to the epidermis. Collagen induction therapy. Here's where the money is. Collagen induction therapy, or CIT, is the primary mechanism behind microneedling's success. CIT works by remodeling existing collagen while also generating new collagen and elastin fibers. It's a three-phase process. Number one, inflammatory phase. Platelets release growth factors, activating the repair process. Step two, proliferation phase. Fibroblasts go into overdrive, producing new collagen. And three, remodeling phase. New collagen matures, tightens the skin, and enhances texture. The bottom line, microneedling turns the body's natural healing switch on, and that leads to improved skin structure, tightness, and overall rejuvenation. Now let's talk about the results. Skin rejuvenation through microneedling is all about improving texture, reducing fine lines, and increasing elasticity. By boosting collagen and elastin production, you're giving the skin a firmer, smoother, more youthful appearance. Patients love this. For scar treatments, microneedling really shines. Whether it's acne scars, surgical scars, or stretch marks, the process breaks down old scar tissue and triggers the new formation of collagen. The results? Scar tissue becomes more organized and the skin texture and color normalizes. We've seen multiple studies to prove that microneedling works wonders for both skin rejuvenation and scar treatments with minimal downtime and few side effects. That's the dream combo right there. Indications for microneedling. Microneedling has been extensively studied, and we know it's effective for a wide range of skin issues. Here's what it's great for. Acne scars. This is the big one. Microneedling significantly reduces the appearance of atrophic acne scars. Skin rejuvenation. It improves skin texture, fine lines, and wrinkles. Melasma. It can reduce melasma, but keep in mind that more research is needed here. Some studies show improvement, others don't, so stay cautious. Stretch marks. Helps remodel scar tissues and enhance color and texture. Alopecia. When combined with topical treatments, it stimulates hair follicle growth. Again, more research is needed, but early results are promising. Skin tightening. Boosts elasticity and firmness. And scar reduction. Helps remodel scar tissue and improve cosmetic appearance. Here are the contraindications. Now, who shouldn't be getting microneedling? Not everyone's a candidate, and it's important to know where to draw the line. Keloid scars. If your patient has a history of keloids, steer clear. Active eczema. Microneedling could make it worse. Psoriasis and chronic skin conditions. Moderate to severe cases should avoid it. Raised moles. You don't want to aggravate or transform them. Blood disorders. Microneedling increases the risk of bleeding for patients with blood disorders or those on anticoagulants. Ongoing cancer treatments. Immunosuppressed patients should avoid microneedling. Active infections. You don't want to spread bacterial, viral, or fungal infections. Pregnancy and nursing. Lack of data means it's best to avoid treating pregnant or nursing patients. Let's talk about precautions. It's crucial to minimize risk and maximize outcome, so follow these guidelines. Health disclosure. Get all the info you need from your patients. Health conditions, medications, supplements, everything. Antiviral prophylaxis. If your patient is prone to cold sores, have them take antiviral meds pre-treatment. Skin pigmentation. For darker skin tones, a melanin-inhibiting regimen before treatment reduces the risk of post-inflammatory hyperpigmentation. Avoid active inflammatory conditions. If your patient has active acne, rosacea, or open wounds, postpone the treatment. Post-Accutane. Wait at least 6 months after Accutane use before performing microneedling. Patient selection criteria. You have got to choose your patients wisely. Not everyone will be an ideal candidate. Look at their skin condition, medical history, and treatment goals. The goal is to make sure they'll benefit from microneedling and avoid any unnecessary risk. So please be careful in looking at the indications, contraindications, and precautions before you treat anybody. Also, let's talk about risk. Every procedure carries risks. Microneedling is no exception. Let's break down the most common ones. Skin irritation and erythema, common. and it looks like a sunburn for a day or two. Edema, mild swelling, especially in sensitive areas, it usually resolves in a few days. Bruising, this depends on your patient's sensitivity and treatment intensity. Dryness and flaking, it's part of the healing process, and most patients go through this. Infection is rare, but it can happen if aftercare isn't properly followed. Hemorrhage, some minor bleeding is normal, but deep bleeding is rare. Pain, there can be discomfort during and after the procedure, but severe pain is unusual. Post-inflammatory hyperpigmentation, especially in darker skin tone, this can happen if patients don't protect themselves from the sun. Scarring is rare, but it can occur, especially in those prone to keloids. Allergic reactions can happen with the use of topical products typically. Herpes reactivation is caused by trauma to the skin, which can reactivate herpes simplex in patients with a history of cold sores. Acne eruption, it's rare but also possible. Unsatisfactory results. Make sure that your patient has realistic expectations. Textural changes. Some patients may experience roughness or unevenness as the skin heals. Increased sensitivity to topicals. Post-treatment, the skin can be more sensitive, so adjust your skincare regimen accordingly. Photosensitivity. Increased sun sensitivity means broad spectrum sunscreen is a must after treatment. All right, before we even touch that microneedling pen, the first thing you need to do is a solid patient consultation. I can't stress this enough. This is your chance to establish clear treatment goals, set expectations, and go over the patient's medical history. You need to cover all the benefits, potential risks, and side effects, leaving no stone unturned. And here's the kicker. Informed consent is not optional, it's a must. This ensures your patient is crystal clear on what's about to happen and what can go wrong. Even though, let's face it, complications are rare when you know what you're doing. Skin assessment. Next up, let's talk about the skin assessment. You can't just drive in blindly. You need to take a thorough look at the patient's skin type, figure out what the target areas are, and identify any contraindications like active infections or inflammatory conditions. The goal? To help you determine the right needle depth and technique to get the results that your patients want. Precision here is key. This is not a one-size-fits-all deal. Prepping the patient correctly is non-negotiable. Proper pre-treatment can make or break your results. Let's break it down. Medical history. Let's get that medical history form completed. Make sure your patients disclose all medications, supplements, and health conditions. Don't skip this. Medications and topicals. Retinoids, retin-A, exfoliants, gone 48 hours before treatment, ideally. Accutane, they need to be stopped at least 6 months. Blood thinners like aspirin or ibuprofen, ideally stop 5 to 7 days before your treatment. Sun exposure, no direct sun exposure or tanning beds or self-tanning products for at least 2 weeks prior. And every patient should be using SPF 30 or higher daily. Skincare, the treatment area needs to be clean the day of. Stay away from harsh products or other treatments like peels, lasers for at least a week before microneedling. Hydration is key here. You need to tell your patients to drink a lot of water, no alcohol 24 hours before, and no shaving the treatment area on the date of the procedure. Prophylactic treatments such as cold sores and antiviral is a good idea. Any history of keloids or weird wound healing, just get that out in the open and have a discussion before anything is done. Other consideration, if the patient is prone to anxiety, plan to take evidence, have them arranged for transport. Make sure they're wearing comfortable clothes to allow access to the treatment area. Now, here are your required equipment and material. You need to be armed with the right tools. And here's what's non-negotiable. Obviously, your microneedling device should be FDA approved, clear, sterile. Could be a derma roller or automated pen device, depending on the area you're treating. Topical anesthetics, lidocaine cream should be applied at least 30 minutes before to numb the area. Antiseptic solution to clean the skin and to prevent infection. Sterile saline for cleaning the area during the procedure. Hydrating and healing topicals. Typically, people use hyaluronic acid. Sometimes you can use growth factors or peptides and to lock in moisture and to promote healing post-treatment. You also want to wear protective gear. Gloves, masks, and even goggles are optional. However, sterility is non-negotiable in your practice. Let's talk about the tools of the trade. There are two main types of microneedling devices, and each has its place. Manual devices, think derma rollers. These are the classic rolling drums with microneedles. Simple, effective, and easy to use even at home. The downside, you're stuck with a fixed needle depth. Automated pen devices. Now we're getting to the real powerhouses. These electric or battery powered pens give you precision. You can adjust the needle depth depending on the area or condition you're treating. They're faster, more efficient, and ideal for clinic use. The depth of penetration is critical. Go too shallow and you won't get results. Go too deep and you risk unnecessary damage. Here's a quick guide. Superficial treatments such as fine lines, hyperpigmentation, you want to stay at 0.5 to 1 millimeters. Moderate treatments such as deeper wrinkles and moderate scars, 1 to 1.5 millimeters. Deep treatments such as severe scars, deep wrinkles, or stretch marks, you can go deeper into 1.5 to 2.5 millimeters. Also, don't forget about treatment parameters like speed if you're using an automated pen, and the number of passes over the area, and how often your patients will need a session afterwards. Tailor this to their skin response. Now, there are different conditions that need different approaches. Here's how you should adjust your technique depending on what you're treating. Acne scars. These need deeper penetration, especially for boxcar or ice pick scars. You're looking at 1.5 to 2 millimeters with pinpoint bleeding as your endpoint. With hyperpigmentation, you want to stay superficial with this one. Stay around 0.3 to 0.5 millimeters to target epidermal pigmentation without drawing blood. Anti-aging, fine line, and wrinkles, you want to hit the dermis, but not too deep. Once again, about 0.5 to 1.5 millimeters. For stretch marks, you want to go deep for these. Stretch marks typically respond best at 1.5 to 2 millimeters to stimulate collagen in the dermis. For alopecia and hair regrowth, microneedling is an awesome weapon. You're looking at 0.5 to 1.5 millimeters depending on the scalp area, and depending on the patient, you may even have to go deeper. This is your acne scar treatment procedure guide. You will see that depending on the region, the depth changes. This makes sense if you think about it, because in the periorbital area, the skin is very thin, and you don't want to go in too deep, as you may cause damage to the superficial blood vessels underneath. Versus if you're looking at an area like the chin or the jawline, you can go in much deeper. So ideally, pinpoint bleeding is your guide, and you should adjust accordingly. But once again, if you have a deep acne scar in the periorbital area, treatment intervals should be every 4 to 6 weeks, and typically 4 to 6 treatments are needed. This is the hyperpigmentation treatment procedure guide. Once again, for superficial pigmentation, you want to avoid bleeding. For mixed melasma, aim for occasional pinpoint bleeding. and you want to adjust the depth accordingly. Treatment interval should be every 2 to 4 weeks, and number of treatments needed depends on the problem of the patient. Typically, 4 to 6 treatments are what we recommend. This is the anti-aging treatment procedure guide. Pinpoint bleeding means that you're hitting the right depth in the dermis for collagen production. You can increase the treatment intervals here to every 6 to 8 weeks. And once again, always 4 to 6 treatments is what we tell most patients that this is the course treatment until the desired results are achieved. This is the stretch mark treatment guide. Deep penetration is key to target stretch marks in the dermis. Pinpoint bleeding means that you're hitting the right depth. Treatment interval should be every 4 to 6 weeks. This is the alopecia treatment guide. You're looking for pinpoint bleeding to stimulate hair follicles. The depth will vary depending on the area of the scalp. Obviously, parts of the temporal area you want to be shallow because you will find superficial veins and arteries in this area. And if you don't know how deep to go, the basic guideline is start shallow and then go deeper, because you can always go deeper. But if you go in too deep and you cause a major complication, your patient is not going to come back to you. Let's talk safety. You're only as good as your protocols. And when it comes to microneedling, keeping things sterile is absolutely non-negotiable. Sterilization and safety standards should be your top priority to prevent infection and cross-contamination. Every microneedling device, whether manual or automated, needs to be sterilized according to the manufacturer's instruction. Here's the golden rule. Single-use needle cartridges only for automated devices. No exceptions. Every work surface needs to be cleaned and disinfected, and you're wearing gloves start to finish. Let's break this down into step-by-step so there's no room for error. Preparation and setup. Suitability assessment. Start by confirming that the patient is a good candidate. Review their medical history, skin type, current conditions. Don't skip this. If there are any red flags, you need to address them before the procedure. Organize your supplies. Everything should be within arm's reach. You'll need your microneedling pen, sterile needle cartridges, gloves, cleansing solutions, anesthetic cream, serums, gauze, a calming mask, repair cream, and sunblock. Have it all laid out on a sterile trolley. Hand hygiene. Wash your hands thoroughly with soap and water. Common sense, right? Yet so many people rush through this part. Don't be that person. Patient positioning. Make sure that your patient is semi-reclined and comfortable. You need optimal access to the treatment area, and comfort equals compliance. Clean the treatment area. Use a non-alcoholic cleanser to remove any makeup, oil, or debris. The area needs to be squeaky clean before you proceed. Apply anesthetic cream. Apply a thin layer of numbing cream to the treatment area. Follow the manufacturer's guideline for how long it should sit on the skin. Some recommend using plastic wrap over the area to enhance absorption. However, putting a plastic wrap over somebody's face is not a good idea. Remove anesthetic cream. After the appropriate time has passed, remove the cream with sterile gauze and a gentle cleanser or saline. If you're using isopropyl alcohol, make sure it's not too harsh on the patient's skin. Treatment protocol. Photographic documentation. Take some before photos so you got solid proof of your results later. Serum application. Apply your chosen serum, such as hyaluronic acid, to help the microneedling pen glide and boost effectiveness. This step isn't optional if you want smooth results. Prepare microneedling device. Use a new disposable needle cartridge and check that it is sterile. Insert into the pen and make sure everything is clean and ready. Treatment technique. Starting point. We typically begin on the cheeks to help the patient adjust to the sensation. Obviously, treating an area around the eye can be traumatic if the patient is sensitive and scared about having a needle pen around the eye. Needle depth. Adjust the depth based on the area. Once again, shallow for bony areas, also shallow for areas where you expect a blood vessel, and deeper for fleshy parts. Movement. Use stroking, circular, or stamping techniques depending on the area. Go over each area 3 to 6 times, but this also varies on what you're treating and how sensitive the patient is. Keep an eye out for pinpoint bleeding, as this is your indicator for collagen stimulation. Let's clear up the difference between stamping versus gliding technique. The stamping technique, you're pressing the device directly onto the skin, stamping each spot. This gives you precision and control, perfect for zeroing in on problems like acne scar or deep wrinkles. The downside is that it's slower, so you're covering a big area, it'll take more time. The gliding technique, this is all about speed. You're moving the device in a smooth gliding motion over the skin, making it ideal for larger areas like the entire face. You'll cover more ground faster, giving the skin a good overall boost. Both get the job done. If you need targeted results, go with stamping. For more general rejuvenation, gliding is your move. And maintain skin hydration. Don't let the skin dry out mid-treatment. Reapply serum as needed to keep things moving along smoothly and prevent tearing of the skin. When treating the face, divide it into quadrants to get uniform coverage. You can also use a stamping technique for deep scars and wrinkles. Aiming for pinpoint bleeding here, remember, don't use tap water during the treatment to clean the skin. Sterile saline only. Here's your post-treatment care. Immediate care is wipe away any traces of blood and apply a calming mask if you have one. Your patients will love you for this. Photographic documentation. Take your after photos so you got solid evidence and comparison of what the skin looks like when the treatment is done. Post-treatment application. Apply a repair cream if you have one, and an SPF of 30 or higher to protect the skin. Patient instructions. This is critical. Walk them through the post-treatment care. No sun, no makeup, no hardcore skincare products for a few days. Make sure they know what's normal and what's not when it comes to side effects. Pain tolerance varies, and you got to be prepared. Most people are fine with just a topical anesthetic applied 30 minutes beforehand. But if you got someone who's particularly sensitive, you can explore other options like cooling devices or even a nerve block, tailored to the patient. Sensitive spots like the forehead, upper lip, or near the eyes need extra care. Go with a shorter needle length and adjust your pressure and speed accordingly. Trust me, the last thing you want is to cause unnecessary discomfort. Post-treatment care and patient instructions. Post-procedure care starts with the minute you're done. The skin is going to be red and feel tight, kind of like a sunburn. Your goal is to calm it down and help it heal. A good hyaluronic acid serum is your best friend here. It can hydrate and calm the skin. Some studies suggest waiting a few hours before applying any occlusive products to let the microchannels close. A cool compress, not ice, can help with redness and swelling. Make sure your patient knows to avoid the sun like the plague. Broad spectrum SPF 30 or higher is non-negotiable. Home care instructions for patients. Now, this is where the patient compliance become essential. Proper home care equals better results. Gentle skin care. Advise your patients to use gentle products for the first few days. Harsh chemicals, exfoliants, and acids? No, not for at least a week. Avoid excessive heat. Tell your patients to avoid anything that increases skin temperature for the first 24 to 48 hours. That means no saunas, hot showers, or intense workouts. Sun protection. This one's simple. Sunscreen every day, no exceptions. No makeup. No makeup for 24 hours. Microneedling opens up microchannels, and you don't want those clogged up with makeup. Now, managing side effects and complications. Most patients will breeze through this without a hitch, but you need to know how to handle the curveballs. Bruises and swelling. Arnica gel can help speed up healing. Peeling. This is part of the process. A mild moisturizer can help. Infection. Rare, but if they notice increased redness, swelling, or pus, they need to call you ASAP, and you need to get them on antibiotics. Hyperpigmentation. More likely in patients with darker skin. Pre-treat with melanin inhibitors can also reduce this risk. Follow-up schedule. Don't leave them hanging after one treatment. Schedule follow-ups to monitor healing and results. Typically, your patients will need multiple sessions, spaced anywhere from 2 to 4 weeks apart, but once again, depending on their skin condition. Combining microneedling with topical treatments. Microneedling is a fantastic treatment on its own, but combine it with the right topicals, you're taking the results to the next level. Growth factors and peptides. Apply these post-treatment to speed up healing and collagen production. Vitamin C is great for pigmentation, but you may want to wait a bit after microneedling to apply it. This can sting, and you want the microchannels to heal first. Hyaluronic acid is a no-brainer for hydration and skin pumping post-treatment. Exosome is another treatment option. However, more research is needed until this becomes a mainstream treatment. Integration with other aesthetic procedures. Microneedling pairs well with other treatments, but timing is everything. PRP or PRF combined with microneedling boosts healing, regeneration, especially for acne scar rejuvenation. Laser and light therapy. Pairing microneedling with laser and LED therapy can enhance overall outcome. Just be careful with the timing. Don't perform both on the same day unless you want complications. Microneedling tech is evolving. If you're staying ahead, you'll see better results. Radiofrequency microneedling. This combines microneedling with RF energy for skin tightening and deeper collagen production. It's like microneedling on steroids. However, these devices are expensive, and also this can cause more pain to your patients. Nanotechnology is a newer innovation that delivers active ingredients direct to the skin. However, more research is needed before this becomes a main treatment option. Bringing microneedling into your practice, here's what you need to know. Training and certification. Make sure your team is properly trained and certified. You can't just hand someone a pen and call them an expert. Quality equipment. Invest in top-tier, FDA-approved or cleared devices. The better your equipment, the better your results. Regulatory compliance. Stay up to date with local federal regulations. You don't want to get caught with outdated practices or tools. Setting patient expectations. This can make or break their satisfaction. Here's how to handle it. Consultation process. Be transparent from the start. Make sure they know what to expect, how long it will take, and what the recovery looks like. Visual aids. Show them before and after photos from realistic patients so they can visualize the process and the outcome. Written materials. Provide them with resources, brochures, reputable websites, whatever helps them stay informed. Legal and ethical issues in cosmetic dermatology. Informed consent. Once again, this is a must. Walk them through the risks, benefits, and alternatives and get it in writing. Advertising. Keep it real. Don't overpromise your marketing. Set realistic expectations so no one is disappointed. Privacy and confidentiality. Make sure you're complying with HIPAA. Patients' photos, medical records need to be protected. So that completes the basic microneedling 101. The key takeaway is precision, patient care, and safety. Microneedling is an incredible tool in your aesthetic arsenal, but it's all about how you use it. Stick to the protocols, stay on top of the latest advancements, and you'll deliver results that have patients coming back again and again. This is Dr. J. Park with Cosmetic Microneedling Training. Contact us if you have any questions or concerns. Thank you very much.